Thanks for joining us today for the Young Health Professional Speaker Series. This series is sponsored by Chicago South AHEC, which is an Area Health Education Center program of Project Brotherhood. The mission of AHEC is to improve access to quality healthcare, particularly primary and preventive care, by improving the supply and distribution of healthcare professionals via strategic partnerships with academic programs, communities, and professional organizations. Founded in Chicago, the mission of Project Brotherhood is to increase health awareness among Black men by providing preventative health messages and education in a cultural, gender, and age-specific way. Be sure to subscribe and let us know what topics you would like to hear discussed on our show. Enjoy the broadcast.
Good evening, everyone, and welcome to the Speakers Bureau podcast again. Today I have Hannah Schroeder and Carrie Seagray today joining us. So Hannah Schroeder currently serves as the Senior Manager of the Sciences Curriculum at Transfer. She has nearly 15 years of experience in hospital-based nursing, education, and professional development with a robust cardiac background and certification in progressive care nursing. She completed her undergraduate nursing studies at University of Wisconsin-Eau Claire, and in 2018 completed her master's degree in the nursing education at Capella University in Minneapolis, Minnesota. Shortly thereafter, she obtained her certification as a certified nurse educator, CNE, and as a certified healthcare simulation educator. Hannah Schroeder is also MSN ED, RN, and then with the CNE, CHSE, and PCCN titles at the end. Carrie G. Gray, MSHS, CHSE, CHSOS, GS, HQS, is a health sciences curriculum specialist at Transfer and brings extensive 20 years background in emergency medical services, culminating as a critical care flight paramedic. In addition to this pre-hospital experience, Carrie has 13 years experience in healthcare education and simulation. She obtained an undergraduate degree in EMS education from Idaho State University and holds a master's degree in healthcare simulation with a graduate certificate in healthcare quality and safety from the University of Alabama at Birmingham. Additionally, she is dual certified in healthcare simulation education, CHSE, and healthcare simulation operations specialist, CHSOS, placing her in an elite group of individuals. Thank you all for participating today in our chat.
Thank you for having us.
Yes, thank you for having us. Appreciate being invited to attend.
Yeah, so this is probably one of the first times I think we've actually had two people interview, like talking about two different experiences at the same time around a similar topic. I think this is a really special thing that we can really do because we can see how two paths converge in the similar spot. You know, I think both of you work for Transfer, so I'm really curious to see how you got to that point. Each one, if you guys want to start, I think I'm just going to go with Carrie first. How did you end up getting into working in this field?
So for a very long time, probably starting when I was a young adult, I really liked teaching and then taking care of people at the same time. And so basically through my EMS career, unfortunately, it's getting better now, but when I started in EMS, pay was not an equitable thing. You don't get paid very good being a paramedic. And so I would always try to find the side kind of jobs and things that I could do to help supplement my income. And teaching was one of those things. And then I came across in paramedic school, I came across healthcare simulation, and I was really fortunate to have a instructor who was willing to teach us the backsides of simulation. And so I kind of really started to grow the teaching and the simulation on the side with my paramedic stuff. And then when I was flying, it's a very difficult job, both physically and emotionally. And I had determined that I probably wasn't going to be able to work in EMS longer than about 25 years. And so I was essentially, I called it my peace out plan for EMS, and something that was more sustainable as I got more mature in my life. And just by happen chance, I was hired in an academic unit at a college of medicine for a simulation education position. And through some of my educational contacts and things like that, I found out about the master's degree in healthcare simulation. And so I was like, oh, yeah, this is exactly what I want to do. And that's how it drove me to get my master's degree. And then ultimately, the place that I was working in academia just didn't value simulation the same way that I value it. And I came across Transfer, and they had all of the desires in a job description that I wanted. And so I actually joined the company about 6 months ago now. So I'm fairly new into Transfer, but have a lot of experience on the side of like a regular full-time job doing healthcare simulation.
Wow, that's really interesting. Honestly, I forgot to tell you guys. First off, I had never heard of healthcare simulation until I looked up Transfer and I read you guys' bio. I was like, what is this healthcare simulation? And I even know there was degrees of that for that. So I thought that was really interesting to even think about. What was like your, so you've been there for 6 months. So what's your favorite part so far working in healthcare simulation?
Well, I got to say probably like the number one best thing that I really love about healthcare simulation is that it gives people, whether they're professionals or learners or, you know, somebody in education, an opportunity to practice the things that they're going to be doing in a safe and like a psychological safe space to make mistakes and learn from their mistakes versus just doing that out in the real world. And, you know, when I started in EMS, that we practiced on each other, but we really didn't know if those things would work until we actually did it on a patient. And that was very anxiety creating and difficult. And so just really knowing that you're making that change with individuals who are getting into a health science career or individuals that are professionals and they still need to practice some of those skills or team building and those kind of things really is what I like about it.
Yeah, that is really cool being able to just, you know, see in real time how does it work. Because yeah, I can imagine the anxiety of being like, am I pressing down enough to keep someone alive? You know, with the CPR, and I'm like, I hope this works. You'll know until you hear those bones crack when you're actually doing it. Yeah, so thank you. Hannah, how did you end up here at Transfer?
So I'll just say, you know, I'm a bit of a geek and things like that. I really love math and science and have loved math and science forever. Math, there's like one right answer, right? Like there's always one right answer in math. That's not the case in healthcare, but there was in math. But that kind of led me to be interested in a lot of healthcare because you're applying the math and the science together and you get to actually help a person. So when I graduated high school, I thought I was going to be a chiropractor, which I always wanted to do something healthcare. I don't know why I wanted to do that in particular. I'd never actually even been to a chiropractor at that point, but that was something I wanted to have my own business and do that thing. That was kind of the path. Well, then I got in school and took my first year and I was like, I don't know if this is what I want to do, and kind of did a little soul searching and decided I wanted to go into nursing. And you know, thought I would be delivering babies. I wanted to do the whole mother baby thing. Like that was where my heart was at. And you know, worked while I was in college as a resident assistant at a community-based residential facility, so assisted living type of situation. Got to have some really great relationships with some of those residents who were there. It was fun to take care of them and interact with them. And I worked nights full time while going through school. Um, and then after school, I got hired at a local hospital where I was doing cardiology, cardiac and progressive care nursing. So in that situation, you know, it was great. I was working as a charge nurse and precepting people and helping them learn their way, got promoted into a leadership role within that department, and had my own kids, and then decided I don't want to do mother baby nursing anymore. And it's just kind of steered myself right away from that specialty, but really loved what was going on with the heart. So I stuck with that, and eventually through the leadership role focused on educating our staff members, and then moved into a centralized nursing education role within our hospital and worked on building our simulation program. I found there was equipment sitting on shelves that wasn't being used, and I couldn't figure out why we weren't using something that was so cool like this. Now granted, it looked a little archaic, but it was still way cooler than the presentations that were just slideshows. So I dug in and pulled out reference manuals and owner manuals and went to the literature and tried to figure all of that stuff out. Taught myself how to do simulation, went to school for nursing, my master's in nursing education at that point, got my certification there, got my certification in healthcare simulation, and grew our simulation program to serve not just our hospital site, but multiple hospital sites within our system, and was the only certified healthcare simulation educator within our system of 15 hospitals across multiple states. And then decided that I love simulation so much that I really wanted to focus on that. And so then I began looking for opportunities to really just focus on that passion and trying to figure out how I can help teach people better, how I can help advocate for the use of simulation and the benefits that it has, and found the role with Transfer. I came to Transfer close to 2 years ago. I'm coming up on my 2-year anniversary, and was brought on to help manage this content and develop it and bring it out, because we didn't have healthcare content prior to that. So it's been a great little pathway for me, not according to initial plan, right? But you go where life leads you, and it's good to identify what you like and what you know you don't like, and move on from there.
Yeah, no, for real. From the dreams of being a chiropractor to now, wildly different, So, so yeah, no, I think I'm excited to actually dive into what like health simulation is, because like it sounds interesting, it sounds techy and health like related. Honestly, it's like the perfect intersection for me. Even though my background is more in epidemiology, it's still really interesting to talk about. So I think I want to start maybe a little bit further back, like for example, in school. So what schools, or what type of schools should people look for if they're interested? Actually, no, generally, what is health simulation? Either one of you guys can answer that. I'm not sure what to ask, but what is health simulation generally, or can you give me like a rundown on what that is?
Yeah, there are multiple different modalities of simulation that are considered healthcare simulation. Sometimes you might think of like a mannequin type of thing, a simulated body where you can do different activities with that. We also have such things as what are called task trainers, which might be if you were trying to start an IV instead of practicing on each other like Carrie did, you might use this little plastic and rubber silicone arm to practice starting your IVs on that and getting the process down before you go and just start stabbing actual person. So you can hone your skills that way. So we have task trainers, and we have mannequins, we have simulated participants, which might be actors and actresses who are portraying the role of some type of a medical condition. Maybe they even have it themselves, but they act in a way that's standardized for multiple people to interact with them and get the same type of an experience. So you can learn a lot of assessment skills or communication skills that way. And then, of course, we have the technology type of things. Carrie, do you want to dig into the technology type of Sims?
Sure. So in the technology world of Sims, we have basically 3 different buckets. There's the virtual reality bucket, which Transfer is. So think of fully immersed in a simulation where you're wearing goggles. You may or may not have hand controllers, because nowadays they have those hand tracking for that. And then you have augmented reality, which is where a virtual reality gets put over our real life of what we see. Sometimes this can be done with a phone. Sometimes this is done with goggles. There's glasses out there that are about that. And then lastly, there's like 2D screen-based type simulation, which is something similar to what we're doing here in a podcast. So maybe you would use a standardized patient or that simulated patient as a patient, and then you could have a team interviewing that patient, or you had alluded to CPR earlier. So the American Heart Association in BLS, ACLS, and PALS, which are more extensive type trainings, they actually have a portion that you can do like a game on the computer to know, how deep compression should be, those kind of things. And so that's a screen-based modality for simulation.
Oh, wow. That's interesting. Like, I didn't realize that there's physical things of medical simulation or health simulation, and then there's the virtual space. Like I said, I remember seeing on the site of Transfer, I remember seeing the goggles. I'm also a gamer too, so I'm used to seeing the headsets, the goggles, and people playing like Beat Saber. And I was like, wow, this is actually interesting how they're using, almost like video game tech to really as a teaching tool. That was really cool.
Absolutely. Yeah, our virtual content is actually built on Unity, the Unity engine.
Oh.
So it very much follows the same type of thing as serious games or video games. It's a lot of the same.
So you said both of you guys went to school for healthcare simulation. What does the curriculum look like in a school? Like, how do you go to school for that? Like, what's the application process if anyone wants to get interested in getting into healthcare simulation?
So I would say if anybody's interested in healthcare simulation, the first thing that you should probably do is find a advocate like Hannah and myself around healthcare simulation, so that they can kind of show you what it's like in whatever system they work in, because it's a little bit different in a hospital system than it is in like academia or even in high schools and junior highs and those kind of things. So finding that individual is a good start, and then from there you could actually reach out to the Society of Healthcare of Simulation, which is actually an international consortium that has a whole bunch of people like us that are really interested in simulation. They're also the overseeing body of our certifications for both education and operations. So the kind of cool thing about healthcare simulation is that you don't necessarily have to have a clinical background in order to do healthcare simulation. So like you were saying that epidemiology is your background. Well, that's fine. You have clinical, you can go into it. But like I have a old coworker who has no clinical experience whatsoever, and she has that ability to be an educator and an operator. So the operators are the people who help run all of these modalities. So they're kind of, I like to equate them as, if you think Wizard of Oz and the person behind the curtain that helps all of that. So, you can find those advocates, and then the curriculum is really based off of what is called our best practices for healthcare simulation. And so we utilize those, like the system at University of Alabama. Not only do they have that embedded into it, but then they teach you all types of things around instruction in general, but tie it into those healthcare best practices of simulation.
Okay, nice. Okay, that sounds really detailed. So how long are the programs typically for the degree?
At least for University of Alabama's, it was, let's see, I think I did, because I got a certificate on top of it, it took me a year and 1 semester to do, but I had to have my bachelor's degree first because it's a master's degree program. There are a few different programs out there where you can just get a certificate in healthcare simulation. And those probably, my guess is anywhere between 3 months and a year program to do some of those. Hannah might be able to speak more into those as well.
Yeah, there are some out there. I went to school not specifically for healthcare simulation, but just for, my master's was in nursing education, and simulation is definitely a part of that. But as Carrie mentioned, there are some out there. Sometimes, going into the operations specialist role, like Carrie has in her background, I don't have that certification. She's one of those unique few that has both of them. So that's really cool. But even for that, like having a background in technology, AV equipment, troubleshooting, things like that. So if you are somebody who's a little bit more tech savvy, that operations role can be a really great fit for people to still be part of that healthcare simulation community, and definitely helping to create these environments that are going to be successful and efficient. It's the turnover. Sometimes those operations specialists are helping with setting up the scenarios, the mannequins, the equipment. Maybe you're doing an escape room even, and you have to get things set up for that. There's all sorts of different things. Sometimes there might be like a mass casualty simulation. If you think about maybe there's been a storm, that's wrecked a town, right? There are your emergency management groups, your fire, EMS, all your facilities. They have to simulate that to prepare for those type of events. So in mass casualty types of events, sometimes the simulation operations specialists help to give all those special effects makeup to the standardized participants who are in there saying, yep, I hurt my leg, or I'm bleeding out, or I'm just really confused because my head got hit and with some debris that was flying in the storm. So you're given kind of a role, and they help you to look the part. So that way, when a caregiver comes near you and tries to figure out, do I need to give you attention right now? Can it wait until later? It feels more realistic. There's some fidelity to that scenario. So that's something that the simulation operations specialist can do as far as helping to create that fidelitous scenario. But then also, when you're dealing with a mannequin or those types of pieces of equipment in a simulation lab type setting, they might help to make sure that they're charged, that we're changing out the skin if the skin needs to get changed out, or that there's troubleshooting if different elements aren't working. Maybe they don't look like they're breathing effectively, even though they have that capability. And so you have to troubleshoot. Why isn't that working? Our monitor isn't showing the information that it needs to. Why isn't that working? So there's lots of different troubleshooting that they do in real time, so that the educators who are present can just focus on educating in that scenario instead of managing all of the other pieces or elements of the scenario and the simulations.
So I feel like it sounds like everybody has a pet place. As long as you have a bachelor's degree and you're interested in something, like you could work in health simulation. You can be the artists, you could be the actors, you can be the people that design the games, or the trainings. I might sound like games, but design the trainings. Yeah, so it's that's really interesting. So Hannah, what do you do? Like, what's your day-to-day life? What's your day-to-day life or work like at Transfer as the doing the health science curriculum?
Yeah, so a lot of what I spend time doing is actually talking to people, what I would identify as a subject matter expert or external stakeholder, because part of this whole educational process is making sure that we really know what the needs are of our learners, of our public, of the healthcare market, because we want to be designing content that is going to meet the need. And if we don't know what those needs are, then we aren't going to hit the mark. So I am talking to people a lot to figure out, what is that? What does it need to look like? What kind of features or functionality? What type of topics or content? What skills do you want to practice? What other little cross-cutting themes do you need to be including in there? Thinking about, we need to practice starting an IV, but what about starting an IV on somebody who's confused or combative or is afraid of needles? Like, trying to create scenarios that are specifically meeting the needs of our learner population. And we have a challenge, right? Because we're creating scenarios that are going to be used by lots of people, lots of places. But we are trying to narrow that down as much as we can to make this as applicable to a broad audience as possible without veering off from the evidence-based practice guidelines. So what does the literature and the research tell us we should be doing to complete these things successfully to have the best patient outcomes? And so I take all that information in from our stakeholders and our subject matter experts and try and figure out how we can mold that together to create our roadmap of content that we're going to be developing, and mix that with, what limitations or capabilities do we have, what resources do we have within the company, what timelines or budget, and how do we prioritize what content to build right now versus what content we might build later, or what content we won't build at all.
So organizations come to you and like say, hey, we want to practice this, and then you guys design a curriculum around what we want to practice?
At times, yes. Yep.
Okay.
At times, yep. It just kind of depends on what resources and funding and opportunities and what kind of market interest there is in that. Because if it's only one person that's interested in it, we're probably not going to put our resources towards building that in particular, when there's something over here that has a whole lot more interest and opportunities for us to build out and then be able to sell. So we have to look at how much is going into it, how much potential we have to get out of that, and what's it going to take to actually do it.
So what would be your, probably the most, I wouldn't say mundane, but what's the more interesting like request or that you guys had to develop for an organization, or what's one of them?
I guess more recently we've had requests to build out content on the radiologic professionals, so radiologic technologists, and an entire radiology suite type of thing, and training somebody how to become a rad tech, a radiology technologist, through a virtual setup without actually requiring a physical lab on site at that program. So that's one request we've had. We may or may not be able to do all of that, but that's just some of the interest that's been coming in as an example.
Okay, so yeah, thank you. And Carrie, what do you do at Transfer? Like, what's your day-to-day like?
So my day-to-day is like Hannah gets all of this information from individuals and has these conversations. Sometimes I'm involved in those conversations as well. Sometimes I do the interviewing for things too. But then we take that information and, like she said, we have a roadmap. So I'm working the day-to-day roadmap of those particular simulations that we're doing. So like, for instance, right now we're working on a couple career exploration simulations, one to highlight a medical assistant and the other one to highlight a pharmacy technician. And so I will work with the teams that are creating these career explorations and making sure that that curricular content that Hannah was talking about is being displayed appropriately in the creation of these simulations. So I think it's really cool because I'm kind of a kid at heart, even though I'll be 50 here in a couple of years. But one thing that I get to do on a regular basis is get in that headset and look at the simulation itself and give feedback of like, oh my gosh, that environment looks fantastic. We need to keep that. Or I get in there and go, oh, I'm stuck here. I can't move from this point to the next point. Or, maybe something random is going on and there's like a hand just floating anywhere. And then we'd give feedback about that kind of stuff. And so really working interdisciplinary with other team members is an integral part of my day to day. And then another cool part that I get to do, which I find challenging is I get the ability to map out specific curriculum to our curriculum. So, for instance, like certified nurse assisting, I can take all of the curriculum that national requires and each state requires, and then map that out into our simulation so that when we have learners or customers who are interested in like how does this align with our stuff that we already have, we have that piece of information that we can share with them, kind of the why behind we picked this type of simulation.
I like that. Like it is sounds a little more hands-on as well. So I like the fact that you mentioned that sorry, that there's a interdisciplinary component. Because that was in my next question is who do you work with? It sounds like anyone can get into the field. Well, not anyone, but say like anyone with a particular background, they're interested, they can get the master's degree and work in the field. What other like disciplines do you work with on a daily basis?
Quite a few. Like in this role in healthcare simulation with a technology company, we're working with, of course, subject matter experts, right? The people who actually have done this before, or have taught about this stuff, and are making sure we're being honest to what it should be to be accurate to the real world. But then we're working with instructional designers who have background in how do you design educational content. We're working with experience designers to make sure that this full experience that people are exposed to, that there's a good outcome, that the person who's doing that is satisfied with it. We work with extended reality designers who specialize in this virtual world and how do these interactions work? What does this user interface need to do? How do we need to have a mechanic that works for that? And then we have a lot of engineers that are working on the background to make sure that we can design this into that content. And the engineers have to have content from our technical artists and 3D artists and character artists so that they can build all of that stuff and develop it and have those assets or the environment itself. So we have the artists and we have the engineers and we have the designers. But then on the other side of our company, we have our customer service team and our sales teams and our marketing teams who aren't clinical individuals, and neither are majority of our art, engineering, design individuals, but they're all responsible to help make these healthcare simulations a success. It's not something we can do on our own. We have a really great team that are working from all sorts of different angles to make sure that the content we're developing is accurate, it works, you're not going to run into bugs and have a bad experience, that it's actually going to get out there into the market and be sold and then utilized. Because if we make it and it's sold but it's never used, it's just like that equipment sitting on the shelf back in my old hospital that wasn't doing anybody any good. So we want to make sure that the whole process is continued, from idea and inception of that idea to actually generating results and outcomes on the other end.
That is a lot of people.
Yeah, and I would also add into that we have what I guess I would call external stakeholders or individuals that we really want to help move healthcare simulation in a certain way. So like being parts of associations and different things where we can lend our expertise to those individuals or those associations as well.
Oh, yeah, like I said, that's a lot of people. Like talking to so many people across so many fields. Hannah, have you ever tried on the headsets? I was just thinking about it.
Oh, for sure. I have one sitting right here next to me at all times.
Oh, wow. Okay. That is really cool because I know Carrie's like, this is really cool. That'd be my favorite part is just being able to like try in the space, try everything out. They look like
we're in it often.
Like a lot, like every time, once a week, twice a week, or
it really depends on how in the development process we are. Sometimes we have like moments where there's not a lot developed in the headset that's ready for us to look at. Not that we couldn't go in there and play any of the other content that's available, but we also have a lot of other stuff that we have to accomplish. So we can't spend all of our time in there playing all of the different scenarios and simulations. But it's at least on a weekly basis that we're in there playing through a few different things, and sometimes playing it over and over again to see what all is going on or get a good idea of it, and be able to share that information and get feedback, or have it reviewed. We do peer reviews with people outside of the company as well, so that they can validate, yep, you're on the right track, or no, I think you ought to switch this up before you bring it to the market.
I like that. Like, so my favorite part would literally just be, oh, it's game day. I mean, work day, where we're in the headset all day.
I tell you, I often say, I can't believe I get paid to play in a headset, because it's fun, and it's, what makes me really enjoy my, one of the parts that makes me enjoy my job.
So, in your roles, how much does your previous work experience, because you have extensive work experience in the healthcare field, how does that feed into what you do on the day-to-day basis? Do you use it, or what does that look like?
I would say I use mine on a regular basis, really just taking my experience, especially when we're creating those simulations, and going, ooh, does this look realistic? Is this what it's like in real life? Because that's really the goal, is to emulate what real life is like, so that you have that experience already. And so for me, it's all about taking that 20 plus years in EMS, and taking those things that I understand and know, and implementing them into the product that we're creating now. And so I think it's used quite often.
Yeah, I would agree to that, because it really is, even in conversations, right? Our clinical expertise comes forward in conversations, and how we help to understand, recognize the needs of the people that it is that we're talking with, able to translate that then to our internal teams who aren't clinical, and who maybe don't understand the rationale behind why this is so important, like critically important that we get it right. What's happening on the other end of this, or why is it so important that we do this thing accurately and portray it, or that we provide this level of documentation, because of Medicare or medical healthcare being highly regulated. It's incredibly important for us to make sure that we are doing things correctly, because there is a person on the other end that's getting that care.
Yeah, that's deep. Where it's like it sounds like it's very important to have everything accurate. A lot of things are extremely accurate. What are some of the challenges of working in healthcare simulation? I think Carrie said sim earlier, and I think, is that what is like working in that field? What are some of the challenges that you experience sometimes day to day, or working in it?
Let's see. I would say that some challenges that exist is, of course, working with interdisciplinary teams. Just kind of to allude to what Hannah was saying, that sometimes it's complicated to explain healthcare things to individuals who have no experience with that, right? So that can be complicated. And then I would probably say the other difficult part is not so much in the transfer world, but in lifetime, in-person simulation versus virtual simulation, is really the coordination that comes between all of the different parts and pieces when you're running that simulation. Although it can be difficult, I also find that challenge fun. Because it's like the puzzle pieces that you're putting together to make something successful. And so for me, it's kind of difficult for me to come up with those, hurdles, I guess.
Yeah. Sounds pretty, that's good then. You're in a space where you feel confident, and it's pretty easy. My next question is, what gets you up to what motivates you to go to work every day in this field?
I can take this one. I like this puzzle pieces, right? I like to find how we can bring all the puzzle pieces together of, all the and we can't address all of the needs, but as like how many needs can we address with it? How can we create this context and scenario that makes sense, that is fulfilling the needs to achieve the outcomes that we're looking for? How can we make this a great experience for our users, our participants who are going to be in that headset? And how can we make it as applicable to the real world as possible? So really pulling all this information in, it's a cool puzzle to put together and then see that end result come forward and, be really proud of what you've helped to influence and create and give feedback on, and know that, it isn't something you could have ever done on your own, but we have this luxury of being able to interact with these super skilled people that are incredibly intelligent in ways different than us, right? But we need everybody's intelligence to be able to make this successful.
And you, Carrie?
Oh, I think Hannah said that perfectly, to be honest. I also want to add that I get to work with a great team of people. And really, one of the things that drew me to transfer is that they are willing to have core values stated for the whole world to know, but they actually follow those core values too. And so for me, that's really important. And that's what helps me, get up in the morning too, on top of the great team that I get to work with.
That's wonderful. So for anyone wanting to work at Transfer or any other health simulation fields, how would they get involved, or how would they, be able to catch the eye of any of these companies that are doing this amazing work?
I mean, that's a good question. I think, obviously you could go to the website for transfer and look. There's job postings there. I think they've even had, depending on where you're located, although for Chicago it might be a bit of a stretch, but in New York office there are opportunities um, for people to go in and do like internships, things like that with the engineering team. There are opportunities at times, but really, if it's the instructional design that's your passion, or if it's the gaming, the XR, the experience type of stuff, going into that type of content, getting information exposure. We've had a lot of people who have done gaming or artwork in the gaming industry and then came over into this educational technology type of setting to utilize their experience for generating educational content. And like putting yourself out there, getting a portfolio put together. What have you accomplished? Trying to look for those opportunities, little certificates that you can do, the programs that might be available education wise across the nation. And a lot of them are virtual now. So it doesn't matter that you're, local to Chicago, or if you're, elsewhere in the country. There's a lot of virtual opportunities to get certificates or associates or bachelor's degrees in some of these different specialties. And for some of them, it might not be necessary to have a degree, depending upon what your portfolio looks like and what you can put forward to the things that you've accomplished. So we're very passionate about non-traditional career pathways, and bringing people into those non-traditional career pathways, even within our organization, and recognizing that not everybody has to have a 4-year degree, or sometimes even a 2-year degree. But what apprenticeship opportunities can you explore? How can you find that mentor or advocate to help guide you along the way? But uh, look for opportunities to continue to grow yourself, challenge yourself to try something new, and track your journey.
That sounds great. Another question. So, if you could have, what are maybe 3 main qualities a person would need to have to be successful in healthcare simulation? Maybe the top 3. If you can, if either one of you guys can name that.
Okay, I'll give it a shot. I would say you definitely have to have attention to detail, integrity, and then the ability to work well with others.
I like that.
Those are good. Yeah, those are good. I would say like not being adverse to change, because everything's going to change, and you have to be used to that, because especially in an innovative industry like educational technology or simulation or healthcare, there are so many things coming forward, that stuff is constantly changing, and you have to be prepared and embrace the change, because if you're stuck in your ways and won't change at all, you are going to get left behind.
I like that. I think Carrie agrees too. You were also nodding like, yep,
Oh,
yep, yep.
oh yeah,
That's
I'm
true.
going to put that at the top of the list right there.
Yeah, I was thinking more of a simulation where like, oh, that's not work. That doesn't work. Let's scrap the whole thing. Let's redo it. That's kind of. I'm like, no, I was working so hard on that, you know.
It
So,
does
It,
happen. Sometimes stuff shifts. Like, there might have been projects happening, pre-COVID, right? But then COVID happened and people had to put the brakes on and totally shift, walk away from what they were doing to focus on what is this new need? How are we addressing these new challenges? So it's constant and evolving.
very much so. Um, Probably in the next few years, where do you guys see the field of healthcare simulation going? Since you guys been in for a little bit, do you think it's going to be more widely used or stay the same? What do you think?
I think that we're just kind of on the precipice of healthcare simulation, skyrocketing essentially. Although it's been around for a really, really long time, like Hannah had said earlier, often it is in a closet, in the basement, unused, that kind of thing. And I think us as a society of healthcare advocates and healthcare simulation advocates, we're really pushing to get that better research out there that proves that this is like the best way to teach this kind of thing, to change patient outcomes so that people aren't getting injured and they aren't getting hurt from healthcare mistakes and that kind of thing. And so I really think we're starting to really ramp forward in that, and it's going to be a lot more utilized in all types of areas.
I like that. Hannah, do you have anything else to add on to that?
Yeah, I wouldn't argue. I mean, I do think and see that the trends are there. They're your new generations coming in, your new learners, they are not used to learning the way it's been done, right? They want micro learnings, little small sections. They want it whenever they can get it, when it's convenient for them. They want to have innovation. They want to be engaged. They want to be challenged. And so trying just to move forward with how we can best tailor our our resources to fit the needs of that learner population is is innovating through using virtual reality, using whether it's the screen based or augmented or virtual or escape rooms or any kind of the different simulation modalities that force participation and engagement and reflection and all of those types of things. That's really how we can reach those learners in a great way.
Wonderful. Um, any so we're wrapping up. Are there any final thoughts you want to add about healthcare simulation or about the field of healthcare in general that you think maybe students or people who are looking for career change may want to know?
Yeah. Um, what I would say is, this is definitely one of those career pathways through direct patient care, direct involvement that people don't always consider. Like, about an educator role, whether it's in a hospital or in an institution like a college, community college, vocational school, four-year college. But you don't always know about these roles where you can bring the tech side in alongside of the clinical stuff. and be able to still create a lot of good effects and benefits towards not just the patients that you care for, but now the people that you're helping others care for. So it's kind of like this exponential opportunity to impact, our communities through using your experience, but just breaking outside of um, your walls that you can reach.
Yeah, and I think the only other thing I'll add to that is that in healthcare simulation, although a bunch of us do have that clinical experience, it's not necessary. And you don't necessarily have to have a degree either. There are some places that require that basic, 4-year degree, but there's a bunch of people out there who do healthcare simulation, whether it's an educator or an operator, that do not have that terminal degree or a 4-year degree or a master's degree, that you can get started in the career without that as a barrier.
Thank you guys. I really appreciate those final thoughts. With that, we're going to be ending the podcast for today. I want to thank you, Hannah and Carrie, for coming out today and speaking to us about your field. It's been wonderful.
Thank you so much. This has been great. I love talking with you, Alex.
Yeah, thank you.
I agree. And thank you for inviting us.
All right. Well, thank you everyone for listening to our podcast. Check in next time for our next people in our speaker series, and I hope you have a great night.